Hey Facebook, it's Dr. Rick with an Herbal 411 highlight. One of my patients has really bad shoulder stiffness, and we're going to kind of dissect it now, but I wanted to show a couple of things to stretch and a couple of things to build. And that's what we really have to do when you have adhesive capsulitis. Another name of that is frozen shoulder syndrome. What happens is that this muscle here called the deltoid, 3 delt, anterior, medial, and posterior heads of the deltoid, they're huge, and in some bodybuilders, they're massive. But the thing that really initiates a lot of this movement is the rotator cuff, a tiny little muscle underneath there. And the problem with the rotator cuff, you'll hear people say, I have rotator cuff tendonitis, or I tore my rotator cuff. And the problem is the rotator cuff is inherently only good for initiating movement and fine-tuning. But when some people go to the gym and start working out with resistance exercise on their own, it's easy to get really charged up and do an overhead press with a machine using too much weight. The good thing is that it does stimulate the deltoids to grow more. But the bad thing is you probably choke off or chop the rotator cuff because it easily gets strained. So a lot of these exercises I'm going to show you are introductory. If you're not sure what to do, please go see a physical therapist. I have a lot of them around, or at least come to see me first, virtually or in person. I can get what we have to get, X-ray versus MRI, and then move forward. This is my shoulder, and it's out like this. So the problem with the shoulder, as I mentioned, and I have this, is a full thickness rotator cuff tear is not good because you can get by without having this tiny blue muscle here. This blue rotator cuff muscle that has to sneak underneath this acromion and around the shoulder, the humeral head. It has to do this. It has to initiate movement. The rotator cuff comes from the scapula, the shoulder blade, and has to pass through this tiny little arch, the acromion. And in some people, you'll have the arch that points up. Others, it'll be flat. Some people will have a hook to the arch. Those are the 3 positions that are anatomical variants. This one is a bad one. When you have a hooked acromion, it's only a matter of time before you get into the right position and you jam the rotator cuff into or between the acromion, that hook, and then the humeral head. And once that happens, that soft, tiny muscle gets irritated or torn completely, and then it starts to come apart. The farther it goes, the harder it is to fix. The longer you wait, the farther it goes. So it's imperative that you get seen quick if you have an injury. This is when you tear that rotator cuff, you have inflammation. When you have inflammation, this synovium or this joint senses, the shoulder triggers a cascade of inflammatory products. Byproducts to help healing, but unfortunately it also calls in a lot of white blood cells to stop the damage. And it also calls in a lot of fluid to fill the space. The tiny space in here that bathes the area with lubricant is the same thing as a collapsed balloon. So if you have a balloon and you put oil inside the balloon and then you collapse it, or you let the air out, you can get one end of the balloon and kind of rub it against the other because there's no friction and there's just oil. Well, imagine that, and you have to have that drop of oil lubricate so that there's no friction in any movement you do. After a declaration of inflammation, the body throws a ton of fluid in there, synovial fluid, to make as a temporary cast. That causes pain, and that causes you weakness, and you can't move. When that potential space that was collapsed is now full of fluid, there's no room. It feels like your arm is full, kind of like your knee gets swollen after a big hike. Well, the knee is trying to protect itself from all that friction you caused, and the shoulder is trying to protect itself from that overhead press that you did. So we typically will just keep the arm at our side, and then it feels better. It takes some time to heal, 72 hours, hopefully, that's it, and then you're back to feeling okay, great range of motion. Now, if you hold it for more than that in this position, it does feel good because you allow it to heal up, but there's also, underneath all those muscles, a capsule. What holds this humeral bone to this shoulder blade or scapula is a capsule. Capsule of ligament in the front, underneath, and on the back side. And the capsule, when it's not stretched, gets tighter and tighter and tighter. So if you keep your arm like this for a week to a month, your capsule is going to be super tight so that after a while, even if you heal up the rotator cuff, you can't move it. That's called adhesive capsulitis. Capsule is inflamed, adhesive means it's just adhesing down. So one thing that you can do is get mobility going fast. Now the problem is when I say I want everybody to go into a forward flexion, they go like this and they lift the shoulder blade up, which you're not supposed to do. What you have to do, because that's painful. So the easiest thing to do is I'll show you 3 exercises for stretching and 3 exercises for lifting. So this is my bow staff from Aikido. You hold your arm in a neutral position. You try to make sure there's a distance between your ear and your shoulder. So you always want to keep that distance and you remember it. Now you take the arm out straight, you hold the stick underneath, keeping that shoulder blade down, you lift the arm up. And maybe I should start lower because it might be that that person's really injured. So starting from below, keeping the shoulder down, but lifting the arm up. This is doing all the work here. You take the arm, this guy here is passive, this guy's doing the work, and you let it take it upward. They're sometimes called wall crawls. And let it fall down, let it take it upward, and you mark how high you can get. Remember, always have to keep distance over here, because if you wind up going like this and lifting your shoulder up, you're not stretching the capsule. Shoulder down, arm loose, power in the other hand up. And you just get to the point where it's kind of stiff, not really painful, but you know something's getting stretched, and you let it down. These exercises are really easy. They're not what bodybuilders want to do, but this is what you do when you're rehabbing. So this is one position, up and down, always focusing on keeping the shoulder blade down and to the back. I have a good shoulder blade video, so I'll put that down below. Second position is something where you bring the arm across and you stretch the posterior capsule. So there's a pose in yoga called Gomukhasana, and I am really muscle bound, so I can't get it, but this is probably the best I can get when I'm not warmed up. So all I'm doing is just stretching the backside, keeping the shoulder blade down and bringing this arm, the opposite arm does all the work. This one is passive, you just bring it across as best as you can. I can kind of get to midline, that's cool. And you let it go even further, keeping the shoulder down. Remember that ear to shoulder distance, like a ruler if you can think of it, and you just stretch it so you can feel it back here. The first one you'll probably feel underneath. Finally, to stretch out the anterior capsule, it'll be almost like a pectoralis stretch. You grab something from behind you and you lean into it so you can feel a stretch here. This one's a nice one, because it's a common one everybody does before they do bench press. But in actuality, you'll have to get through the big musculature of the pec and then hopefully relax the pec and eventually get to stretch the anterior capsule. I would shoot for about 10 to 20 movements in different positions and holding. Holding is almost like an isometric position when you just wait, and maybe a degree or two more will get you tolerance, will help with blood flow, and help with stretching. You're not going to develop a sweat off of this, but you'll get movement. Now, when you've mastered the stretching exercises and the control of the shoulder blade, I'll suggest 3 rotator cuff exercises, and you don't need much weight. So this is a 2-pound weight. This is nothing. I measured out my Prolon bottle, 2 pounds, 2.5 pounds with Costco's pH balanced water, and then 3 pounds with this thing. Honestly, 3 pounds is max. You shouldn't go over that. I think a lot of guys will think, I can do a lot. But remember, we're isolating the movement to only stress the rotator cuff. Deltoids don't count, pectoralis doesn't count, and the muscles that take care of the rhomboids or the shoulder blade don't count. So if you do this properly, and that's why it has to be very important you get into the right position, to develop one muscle, holding the arm down and just keeping the elbow where it is, you bring the weight up. And it doesn't sound like much, it doesn't look like much, but if you do about 10 to 20 of these and 3 sets of these, you will work the rotator cuff. And eventually you can go up to 2.5, 3 pounds. Please don't go any harder than that. Baseball pitchers usually do exercises like that when they're first starting out or when they're rehabbing. And then you do the opposite side. Watch the shoulder that's sore because that'll hurt. Holding the elbow at the side, you lift up as far as you can go. And I'm, again, limited, but I can feel the end range right here. You have to get really tight, but I have to work on range of motion. You do about 10 to 20 of these, nice and slow, controlling movement, working with breath. Then we do the final exercise for the supraspinatus muscle, the guy that went underneath the arch and is probably weak and torn. You pretend your back's against an imaginary wall and you turn your thumbs down, but you bring your arms forward a little bit, about 30 degrees. And then you let the weight fall. Remember, you always have to pretend that your shoulder blade is flat against the back. You have distance here. You keep the shoulder flat and you just lift the arm up to about 90 degrees from the side. And that is it. You empty the beer can. And again, I feel this most in this position because the rotator cuff, I'm isolating the deltoids. I'm not using the trapezius muscle. I'm limiting the movement to the pec and the lats, and I'm just taxing the rotator cuff. So even with this, I can feel lactic acid burning now. And it is irritating, but I know there's a pump coming. You should always match what you did on the bad side with what you did on the good side, even if the good side's not injured. And again, I would start off with 2 pounds at the least. You can also use elastic bands if you don't have weights. So I got these at Sierra Trading Post for like $2. But you can put together your assortment of bottles, cans, anything, just weigh it on your scale and know the difference. Because you will get stronger and you'll feel it's easier. I would just suggest either you move up a small notch in weight or you just do more repetitions. Always controlling the shoulder blade. Make sure that thing is tacked down, not moving, so you can isolate the rotator cuff work and give it the best challenge you can. Hopefully this gives you a good idea. Remember, whenever you're doing exercises, even if they're tiny ones like this for rotator cuff, finish it off with ice. I like ice. In Chinese medicine, you're not supposed to use ice, it's too cooling. But I think during the time that you're rehabbing your own shoulder, until you know that there's no more pain and there's better range of motion, anytime you finish off an exercise routine, and this will take you probably 15 minutes, honestly. Don't look for a pump, just look for finishing off your set. Now finish off with ice after you're done. A big Ziploc of ice cubes or frozen peas without sauce. You just put it on your shoulder, watch it because you might get frostbite. Sometimes a thin sheet would be important, and you leave it on for about 10 to 15 minutes. If it works properly, it's supposed to really burn like it's frozen, but that way the cold, the thermal, will penetrate down into the rotator cuff area and decrease the inflammation that's coming. Whenever you use muscle, whether it's ready for it or it's injured, you're going to cause a little bit of muscle trauma. But if you can incite a tiny bit of trauma, then hopefully overnight or in at least 72 hours, the muscle will rebuild itself with the proper building blocks of amino acids into a stronger muscle group. And then you continue going on. Sooner or later, you'll have full range of motion. Rotator cuff, whether it's torn or not, will be pain-free, and then you can go back to your movements for developing the deltoids. Hopefully this gives you an idea or two. If you have your exercises that you do with your elastic bands, put them down below. If you think this helped, give me a thumbs up. It helps the channel. Otherwise, don't forget to subscribe to me, my YouTube channel, and I'll see you at the next video.